Hello, Sagar. Because you people are very small number, Maitri is under quarantine, right? I will not mute you. So in between, if you want to talk, you can. Okay. Are you listening? Yes or no? One more. Jiten. Yes, Jiten. Hello. Hello. हाँ सागर, आर यू लिसनिंग? आज हाँ, आपको आवाज नहीं आ रही? अच्छा, देखती हूँ मैं जरा, क्यों नहीं आ रही? हेलो. हाँ, आ रही है? नहीं आ रही ना? हाँ, बेटा ये तो म्यूट पे गया, अब म्यूट माई ऑडियो मैंने कर दिया। अब देखो आ रही है? हेलो, आ रही है? नहीं कॉल तो मैं तो कैसे पता चलेगा? तो फोन को थोड़ा दूर रख करके और सुनने को चाहिए। म्यूट हो गया ना, मैं अपने ऑडियो को अगर म्यूट कर दूंगी तो तुम्हें सुनाई नहीं देगा। हेलो, आ गई है? अब देखो, अब आ रही है? हेलो, देखो, बोलो बोलूं मैं? टॉपिक
हाँ
इज,
जी मैम, आ रही है।
आ रही है क्या?
हाँ जी।
चलो ओके। जितेंद्र आ रही है बेटे? हेलो, हाँ बोल, देख के मुझे बताओ। उसी में मैंने तुम्हें म्यूट नहीं किया हुआ है। दो लोगों को क्या करना है म्यूट करके? उसमें तो 100 लोग बच्चे होते हैं तो उन्हें म्यूट करना पड़ता है। हेलो,
हाँ जी मैम, हमें तो मेरे को तो आ रही है मैम।
हाँ तो उसको वो भी बताए ना, जितेंद्र भी तो बताए। हेलो जितेंद्र, हेलो, हेलो जितेंद्र, हेलो। Oh, time is going unnecessarily. Hello, Jiten, are you listening?
मैम शायद उसने म्यूट किया हुआ अभी, जितेन ने।
हाँ मैम, आ रही
आ रही है ना? चलो, तो topic is learning, right? How to define learning? I told you why I am taking this topic. I have kept this topic. See, behavior is a composite term. If we analyze behavior, we will find level of consciousness, attention, concentration, thinking, perception, memory, judgment, insight, perception, all these. But why I have taken learning in detail? Because you are going to treat your patients, though you must know for all the mental faculties. But why I have taken learning in detail? Because you are going to apply your treatment modalities on your psychiatric patients, and you must know how to make them to learn, isn't it? So learning has to be well understood by you as a psychiatrist. So how to define learning? Learning is, write down, learning is relatively a permanent change in behavior which comes either which comes either through practice or experience, which comes either through practice or experience. And to validate that someone has learned, it is only through a performance of a person who has gone through the learning, Through performance only, we can even predict the future possibilities, whether in future the person will learn or not. In future, the person will learn or not. Now, paradigms of learning or models of learning. There are paradigms of or models of learning. Number one, conditioning, which is of two types: classical. Number two, instrumental or operant. Instrumental or operant conditioning. So conditioning is having two types: classical conditioning, and the other one is instrumental operant conditioning. You keep kindly concentrating on my slide also. Number two, observational learning.
Yes, sir.
Number three, cognitive learning. Number four, verbal learning. Number five, concept learning. And number six, skill learning. So let us come over to conditioning. You might have gone through the Pavlovian conditioning in physiology when you were doing MBBS. The physiological salivation, which was measured by Pavlov, and the basic experimental stage was a dog was kept hungry. And during hunger, salivation starts. But what happened? It was an accidental research which was done by Pavlov. He was a Russian physiologist, and he conducted this experiment and found some accidental observation. He found that the basic experimental condition was that when dog used to be kept hungry, there was a decided time period to provide him food. But before providing him food, he used to ring the bell. The moment after going through repetitive session, when the bell used to be rung, so without even seeing the sight of food, dog used to salivate. It means dog was conditioned to have an association between food and bell. The moment bell used to be rung, and he used to salivate. By seeing a food and salivation, it is a natural learning. But by listening the bell, and he used to salivate on an anticipation that he is going to get the food. So similarly, in our day-to-day life also, when we keep interacting with our family members, and when we during our development we keep interacting with so many environmental stimuli, and we learn many things. So learning which is being precipitated due to association between some stimuli, that is conditioned stimuli, and we keep learning the new things, that is what. So suppose the patient who has come with the phobic reactions, you are doing lots of counseling, He is having so much of anxiety, that is why you have administered or prescribed anxiolytics also. But still, you may try the conditioning procedure. While counseling, you give them a task. The moment you feel fearful, you leave that place. That particular place where you feel phobic, you leave that place and get out of the situation, maybe out of room, maybe out of a crowd, and just have a breathe, and then you go back. Definitely. Halaki, I am using this instrumental conditioning procedure, but how to make the person to learn the association between isolated place, calm and quiet place, that can be conditioned in future as to not to feel so fearful, and then you face the situation. Because phobia is irrational, illogical fear, and it can be increased. The more and more you will avoid the situation, the more and more phobia will be there. So in phobia, you have exposure techniques. In exposure techniques, through counseling, we try to classically condition the patient to get agreed for treatment. Before that, during counseling, we can teach him or we can make him to listen certain associated contents which are making him to be poorly conditioned. We try to make them the properly conditioned. So basically, write down. Classical conditioning is a passive form of learning where everything is being decided by the experimenter or a doctor, and subject or patient has to follow as it is. Has to follow as it is. Initially, classical conditioning procedures are more successful because psychiatric patients, usually of depression or severe anxiety, by using suggestions, we can make them classically conditioned to follow the doctor's advice at thought level. At thought level. See, to see everything in action, it takes time. So first you try to make them amenable, agreeable. Okay, I will be doing this with you. Do you agree or not? If he is not agree, then you have to counsel him to make them amenable to suggestions. This is all learning. During learning, we find number of behavioral changes. For instance, see, bell used to be rung, salivation used to be there. But what happened? Bell was rung, but there was no availability of food. So when this situation was repeated, the dog stopped salivating. अगर हमें अपनी life में, if in our day-to-day life we are having some problem, and if we keep getting strengthened because of proper stimulation, which is making a person to wrongly adjust it. So extinction can be used not to provide him that opportunity where problem is occurring. So what happened? Dog stopped salivation because he anticipated that only bell is rung, but there is no food. Similarly, if we avoid the stimulus, if we remove the stimulus, many of the problems are solved. Right? That is what is called extinction. Discrimination. He gave two types of stimulus, ringing of bell, and another sound stimulus was beeps. When beeps used to be rung, then no food was there. But when ringing of bell was there, then food was there. So dog started associating when food was there, when food will not be there. So used to salivate for bell, but he never used to salivate for beeps. So he started discriminating. Similarly, in our day-to-day life, many of the patients learn to discriminate. Yes, this is the situation where I may be in a problem, but this is the situation where it won't be a problem. आज के डेट में Corona is just dominating the entire society, and it has been said if you have a 5 meter, 5 feet distance, definitely you are not affected. Moreover, you have to have a social distancing, mask, and everything. So you are able to discriminate where I can be affected, where I cannot be. This is what is also learning, which is a passive learning. Means people are the clergy people or educated people, medical professionals are just giving you advices and you are considering them. So you are discriminating. This could be helpful, this would be not helpful. Spontaneous recovery. After when Pavlov saw that dog has stopped salivating, that extinction, again he started repeating the same situation, that he started giving him bell and providing him food. He removed beeps, only ringing the bell and providing the food. When he kept it continued for a number of trial, again dog is started salivating. So if one learned behavior in past, if it is being removed by removing the cause, probably it may reappear if cause is again. In the office, there was a person, official colleague. He used to have so much of interpersonal difficulties. So management thought he will be removed and he will be sent to some other department where he will be sitting alone and doing work. After 2 years, again he joined that department. Again people get disturbed. So this is what is many times it happens where you have treated your patient very well, but you didn't guide them. When you were terminating your therapy, then you didn't guide them. If such kind of situation comes, you have to have a little safety measure. You have to have little caution, but you didn't do. Probably the behavior which is wrongly behavior, rightly learned behavior can also come back. Similarly, wrongly learned behavior can also come. Generalization. Generalization means if a situation where behavior is occurring, probably in an almost similar other situation, person behaves in the same manner. Means he stop discriminating. For example, traffic signal. Traffic signals are green light for going ahead, yellow, just get ready, and red is stop. Whether these signals are being given through a square box, triangular box, round box, it doesn't make much difference. So generalization means if one type of learning which has been taken place, probably in almost other similar situation or causative factors, it may occur again. So it is not bad. In one situation problem was there, now you have advised him almost little different situation, but you have to behave accordingly. So it happens that problem do not occur. One more thing, it is not visible much, that is experimental neurosis. Many times it happens. This is the reason in depression, that is learned helplessness. Many a times person do not try to how to come out of the depressive situation. They just leave it as it is. I had a case, I think 10 years back, I had a case. There, father brought the complaint. He was handling his 14-year-old son and he said, I am not able to control him. Because he took the wrong method with dealing with his son. Very small matter used to beat him. For a small matter used to beat him a lot. Ultimately, one day, that son told, you beat me. To any extent you beat me, I will not do. This is what is helplessness, learned helplessness. कि मैं कुछ कर तो सकता नहीं हूँ आपका, अब आप मुझे मारो, कितना भी मारना हो मारो. और मार खाने के बाद यूज्ड टू बी डिप्रेस्ड, ही नेवर यूज्ड टू बी हैप्पी. तो उसने कहा कि मेरे बेटे को ठीक करो, ये तो उदास रहता है. तब जब मैंने उससे बात की, देन ही सेड इट कि मैडम मुझे इतनी बचपन से मार पड़ी है कि अब मेरा मन ही नहीं रहता है जीने का. कोई भी एनीथिंग कैन नॉट प्लीज मी, इट डजंट मेक मी हैप्पी. What was that? Anhedonia. He was not able to identify the pleasurable aspect of life. Every time he used to be so upset. So many a times, learned helplessness is the reason behind severe depression. And here, that there are certain situations which are uncontrolled situations which keep coming in our life again and again, and person meets with depression. So you have to make him to understand what type of faulty learning has been taken place, which he is not able to handle it because of being classically conditioned and facing learned helplessness or experimental neurosis. Got it? Now let us talk about another aspect of learning, that is instrumental operant conditioning. This form of learning is basically an active form of learning where everything will be decided or counseled or advised by the doctor, but subject or patient has to apply in an active manner, and that is how they learn the right behavior. Here, what is the situation? Instrumental operant conditioning, likho. Instrumental operant conditioning was founded by Skinner, Skinner. Skinner. This is called as Skinnerian conditioning. He was American psychologist. What is he has done? Now look at the monitor. He took the rats, and rats were kept hungry in a cage. The outside instrument used to be there. From there, food pellets used to be dropped, and when this rat used to see these tempting grains of food, they used to get tempted because they used to be hungry. But they have to put a lever in such a way, then only grains or food pellet will come, otherwise will not. Accidentally, by trial and error, the rat used to roam around, keep searching around, and by chance his paw was there onto the particular liver and grain came out. Then after a number of trials, he learned it. If he wants to eat, he has to put the liver, then only he will be able to eat it, otherwise he won't be able to eat it. Same type thing happens where there are many behavior. Look at the phobia only. Phobia is, again I am repeating the same example. Phobia is irrational, illogical fear, and the moment person faces the fearful situation, they turn to be panicky, and how to remove it. So the situation was taken exposure therapy. Behavior therapy में one is exposure therapy. The person who is phobic to a particular situation or particular person, क्या होता है आपको जब पता लगता है, अभी तो आप पढ़े हो गए, लेकिन जहां तक अंडर ग्रेजुएट लेवल में बच्चों को पता होता है, कल जाकर के क्लास में भाग जाते हैं आधे से ज्यादा, because they are phobic. Instead of facing low marks, less marks, they don't want to disturb their impression also, and they don't want to appear. तो उसी तरीके से, but the advice is कि face the viva, face the class test. What else will be? Okay, you will be failed, but at least you will be really in a position to face the next situation, similar situation, with a better confidence. So that is what is the advice in phobia, that you go and face it. So face in imagination. Don't go to the real situation. First you face in the imaginary situation. Imagine it, you have been there in front of you, that particular situation is there, and you are feeling phobic. Maybe phobia to height, maybe phobia to live alone. So they are not ready to go inside the room because they don't want to be alone in the room. So imagine you are in a closed room, there nobody is there, no sounds is there, nothing is there, and you are left alone. Imagine it. Then afterwards, you make him to face the situation in vivo. So go to the room, particularly, and I'll keep your door open, and you just sit inside. You just bear it how long you can. Then afterwards, in third situation, I will be closing the room, but I will not bolt it, and you try to. In fourth situation, I will bolt it. So graduated exposure. This is called as graduated exposure. So the tendency is, if you want to remove your phobia, you will have to face the situation. Otherwise, the more and more you avoid the situation, and more you will be turning to be more fearful, isn't it? But in this conditioning procedure, in the instrumental conditioning procedure, basically the main elements, इसको हम operand conditioning भी कहते हैं, the main elements behind this conditioning is reinforcement. Write down, reinforcement. Reinforcement means it is a situation or incidence. It is a situation or incidence which makes a person to do the behavior or to avoid the behavior more and more. So if reinforcing situation or event is positive, person would do the right behavior again and again. But if it is negative, then person will try to avoid it. Up to what? Up to this moment, I'll be keeping it. If you want to talk to me, you can talk to me. I'm seeing you, Jiten. You are sitting in a room, right? You are sitting in our hospital or OPD में बैठे हो ना तुम, है ना? You are in OPD. And Sagar is not there. Sagar might be at home or somewhere else. So you want to ask anything or you can ask me?
मैम
हाँ.
मैम ये कंडीशन लर्निंग में आपने जो एग्जांपल दिया था वही है क्या इंस्ट्रूमेंटल के लिए भी सेम?
नहीं, इंस्ट्रूमेंटल के लिए तो प्योरली मैंने फोबिया का दिया, और क्लासिकल कंडीशनिंग में मैंने काउंसल करने के लिए जस्ट टू मेक द पेशेंट रेडी टू अंडरगो थेरेपी. सो इनिशियली you cannot make any person so active in first session, right? You will have to suggest them, you have to persuade them, then only you can make them to get ready. तो वो सब हम क्लासिकल कंडीशनिंग पे बेसिस पे ज्यादा करते हैं. लेकिन if a person is ready, like children, they get ready so quickly. But normal children, not mentally retarded or any other problem. But normal children, those who are happy-go-lucky and they are wanting to have a change, so you can make them very active. But during other situation, you cannot. So that is what is the usable. Panic attacks बहुत momentary होते हैं, but बहुत frequently होते रहते हैं. You keep counseling them, you keep taking them to real situation, or you keep taking them. वैसे भी, if you are going to use exposure therapy, initially you can use it through ideational basis, imaginary basis. There is a phobia to insect, cockroach phobia. So a few years back, I had to treat a boy. He was around 14-15 years old. He was having phobia to cockroach. So the moment he used to it, and I just imagine that cockroach is roaming around your body. So he ran away so quickly. Then afterwards, one day I just collected dead cockroaches in a vessel, and it was transparent, and kept it at the distant table at the corner and made him to see it. He ran away. But after a few days, he came and he kept sitting. He was having anxiety, but he kept sitting. Afterwards, after 15-20 days, that I kept that bottle at the table only where you are sitting as a boy and I am sitting, and I kept it. then he was restless, he was perspiring. बाद में पता चला कि शक्तिमान देख करके उसको कुछ फोबिया डेवलप हो गया था, पता नहीं क्या हुआ था, तो पूरी सिचुएशन मुझे ठीक से याद नहीं. But one day I collected the living cockroaches in the bottle only and he got little cured. उसके बाद ठीक हो जाते हैं. स्नेक से फोबिया, तो स्नेक का फोबिया लोग छोड़ देते हैं बिकॉज जंगल में कौन जाता है. अब कोई रेंजर हो या फॉरेस्ट ऑफिसर हो तो बात है अलग, अदरवाइज इट इज नॉट सो. बट देयर आर सर्टेन सिचुएशन, टीचर से डर लगता है, प्रोफेसर से डर लगता है, तो लाइक दैट ये फोबिक सिचुएशंस को हम ट्रीट कर सकते हैं इंस्ट्रूमेंटल कंडीशनिंग बेसिस पर. डिप्रेशन में लर्न हेल्पलेसनेस can easily be started with classical conditioning, not to unnecessarily penalize them, but afterwards you can make them active, because depression, if it is mild in nature, easily treatable by suggestions as well as classical conditioning. But if it is very severe, you will have to make them relax by giving them anti-anxiety and antidepressants. Then afterwards, after a few days, you can send them for psychotherapy and behavior therapy, that is CBT, cognitive behavior therapy. तो अभी बहुत ज्यादा तो नहीं हो पाता, एक तो 45 मिनट का सेशन ही होता है और उसके बाद फिर ये प्रॉब्लम्स आती हैं, तो I have taken it very small sessions and I will keep doing it. Okay.
Thank you, ma'am.
Okay, I am ending the session. Okay. Okay, bye.
Okay. Thank you, ma'am.
Okay.
Okay, beta.
Thank you, ma'am.